I am going to briefly repeat some of the testimony that I provided last Wednesday regarding the background for this supplemental request. The department has submitted more than $90 million in supplemental funding requests to meet payment obligations through the end of state fiscal year 13. Maine Care, the state's Medicaid program, will require $87 million of that request to meet its payment obligations through the end of the current fiscal year. Other non-Maine Care programs will require approximately $6.6 million. There are several factors that influence the need for supplemental funding, beginning with the loss of significant federal funding. Since 2010, overall Maine Care funding has remained somewhat flat, but overall general fund expenditures have increased by over 65%. This is because the state has lost more than $630 million in federal stimulus funding received through the American Recovery and Reinvestment Act of 2009. Another contributing factor is the reduction over the years in the federal Medicaid assistance program match rate, which was nearly 75% in 2010. And in 2013 stands at 62.5%. Higher cycle payments are also contributing to the shortfall. We project $54 million in additional expenses over what was initially budgeted in Maine Care. In addition to these expenses, the lack of federal approval on some legislatively approved changes in Maine Care, the delay in approval of others, and the inability to achieve savings that were contained in the budget have clearly impacted our need for supplemental funding. As I stated last week, even with the approval of our requests, Maine Care general fund expenditures this fiscal year are projected to be about $30 million less than fiscal year 12. I now will take you through the 9 initiatives regarding the proposals before you in this morning's hearing. And to try to simplify and make sure that we have the page numbers and the document that you are using, we begin on HHS page number 17. Initiative pertaining to a fund balance in the Fund for a Healthy Maine. It is a transfer of $2 million in other special revenue into the medical care payments to providers program, into the medical care program within the Fund for a Healthy Maine, and decreases the general fund obligation in the medical care payments to providers fund. The next initiative is on HHS page number 13. These are part of the curtailment within the Office of Elder Services, within the Office of Aging and Disability Services, the newly consolidated Office of Aging and Disability Services. There are 2 initiatives there pertaining to contract reductions. The first is $124,736, and the second is $168,384.
Commissioner, if I could interrupt, Senator LePage. Oh, I'm sorry. Gorney, is that correct? Representative Gorney will find this, but just tell us where to look.
So this is on your document, HHS page number 13. So this is, we were asked to tailor our package and presentation today based upon the document that was prepared for you by the Office of Fiscal and Program Review. So this is your document that has each of the different departments' initiatives. It is the LR 1045 at the bottom of the page.
You should find it behind the tab for Health and Human Services in your book. And then HHS has its own numbers, 1. through page 34.
The next initiative.
Are we ready to go forward, everyone? All right, thank you. Thank you,
The
Commissioner.
next initiative, HHS page number 14, drugs for the elderly. This initiative removes funding for the DEL program, which covers co-pays, Medicare Part D premiums, out-of-pocket costs, and the cost of excluded drugs. The savings to the general fund for this state fiscal year, $985,913. The next initiative, HHS page number 17, DD, Elderly PNMI Room and Board. This reduces funding by eliminating state-funded medical coverage for individuals who are meeting a deductible necessary to become Maine Care eligible and who reside in private non-medical institutions. This provides savings of $232,000 in state fiscal year 13. This initiative reduces funding by eliminating state-funded medical coverage for individuals who are meeting a deductible necessary to become Maine Care eligible and who reside in private non-medical institutions. The state is paying 100% of their services, less cost of care, while the individual is meeting their deductible. This initiative will prospectively eliminate coverage. Existing recipients of this service will not lose eligibility. The next initiative, HHS page number 18, this is a position reallocation within the Office of Elder Services Central Office. This reallocates 50% of the cost of one management analyst 2 position and related all other from the federal expenditure fund to the general fund within the Office of Aging and Disability Services to correctly reflect the work that is presently being done. HHS page number 19. This pertains to the executive curtailment order within the Office of Aging and Disability Services, although in your document it continues to refer to the Office of Elder Services. It's contract reductions of $173,908, and I believe that that concludes the initiatives for this morning's session.
Commissioner, thank you, and I think we have some questions.
Commissioner, good morning.
Good morning.
On the last, initiative, the reduction in funding for contracted services, can you repeat what those contracted services are?
There are a variety of services that, again, these are spread out across a number of different contracts. If you do not have I know Health and Human Services received a document last week, and I believe copies, if they are not here, they will be distributed today. That is all of the affected providers. We have provided a crosswalk with the appropriation number, so you'll see the individual provider, the description of the service, and the appropriation that it aligns with.
Thank you very much.
Yep, are those in there?
Other questions or comments for the Commissioner?
Thank you very much.
Thank you so much for being